Hello and welcome to the channel. Hope you will enjoy our new video that is part of our autonomic nervous system series. And in this one we're going to focus on the otic ganglion and submandibular ganglia. These are two very small, very hard to visualize parasympathetic ganglia of the head. You know that there are two more of those parasympathetic ganglia, and these are the nasociliary and the pterygopalatine ganglion. We have separate videos on those. If you want more information, consult those. Now, otic ganglion. It's located underneath the skull, behind the mandibular nerve, in the infratemporal fossa, while the submandibular ganglion is located underneath the tongue, in between some structures that we're going to discuss a bit later, because before we go into the morphology, I want that we familiarize ourselves with the neuroanatomy of the region, so you know what is the deal with these two structures and what is their function, of course. Go! We have the submandibular ganglion here, and you can see it has 1, 2, 3 roots. This one is arbitrary, but these two are very consistent, and as all parasympathetic ganglia of the head, you know it has the neuronal bodies of the postganglionic parasympathetic neurons. And where are these postganglionic neurons getting their input from? They're getting it from, of course, the preganglionic neurons. In the case of the submandibular ganglion, the preganglionic neurons are located in the superior salivatory nucleus of the facial nerve, which, while passing through the temporal bone, would give off a small branch, a small nervous branch named the chorda tympani, which would house these preganglionic parasympathetic fibers. It would pass through the inner ear, on the inside of the inner ear, right? So it will go over the malleus and the tympanic membrane, go through the petrotympanic fissure on the skull. This is a small crevice in between the tympanic bone and the petrosal bone on the skull. And while it leaves the skull from this fissure, it would join, after it goes through here, it would join a nerve that's called a lingual nerve. The lingual nerve is a branch of the mandibular nerve, which is a branch of the cranial nerve number 5, which of course you know is the trigeminal nerve, right? So it would join the lingual nerve, and it would use it to hitchhike along with it, because the lingual nerve eventually would pass quite near the submandibular ganglion, and at this point these fibers would then go out from the nerve and join to the submandibular ganglion, where they will make their first synapse, and from here the postganglionic fibers would originate. Now, as all parasympathetic ganglia of the head, you know that they also have a sympathetic root, which you can see here in red, and this sympathetic root, you do remember, I suppose, that it does not make a synapse here, and that these are the fibers of the postganglionic neuron, the postganglionic sympathetic neuron, right? So they do not make connections, they just pass transiently along with the parasympathetic fibers. They do not contact in the ganglion, make any contact in the ganglion, and they would be found in the fibers of the ganglion innervating blood vessels extra. And where are they coming from? For all parasympathetic ganglia of the head, they are coming from the superior ganglion of the truncus, of the cervical portion of the sympathetic trunk. If you don't know what the sympathetic trunk is, this is just a collection of sympathetic ganglia along the spinal cord, spinal column, not cord, and they originate from the thoracal portion of the spinal cord. For more information, you can refer to our other videos. In general, the lateral horn, in this case in the upper thoracal levels, T1, would house the preganglionic fibers. They would go into the superior cervical ganglion, make synapses there, and as postganglionic fibers, they would wrap around the arteries which are going towards the head, so they use the arteries as highways to reach the structures. In this case, the closest artery to the submandibular ganglion is the facial artery, so it would use the facial artery. And as the other two ganglia which we discussed earlier, ciliary and sphalopalatine, this one as well can get some somatosensory fibers from the lingual nerve as well. And that's pretty much it. Not very difficult. Now, the other ganglion, the other ganglion, the otic ganglion, would have a very similar look, but one major difference is the superior salivary nucleus is the origin, of the preganglionic fibers for the submandibular, while the otic ganglion, you can see it's the inferior salivary nucleus, right? So I have superior here and inferior here. Now, what is happening here? Similar as far as the sympathetic system goes, exactly the same thing as the previous. And exactly the same thing happens in the pterygopalatine, exactly the same thing happens in the ciliary ganglion, just different arteries. And in this case, the closest to the otic ganglion is the middle meningeal artery, so it would get its fibers from the middle meningeal artery. Now, the preganglionic sympathetic fibers, parasympathetic fibers, are coming from the inferior salivary nucleus, part of the glossopharyngeal nerve. This nerve would give a small branch called the tympanic nerve that goes through the tympanic canaliculus to enter the inner ear, where it makes a small nervous plexus known as the tympanic plexus, or at least takes part in forming this plexus. From the tympanic plexus, a small nerve called the lesser petrosal nerve the tympanic plexus would give off a small branch called the lesser petrosal nerve, and this lesser petrosal nerve would pass through the foramen vale, join again the ganglion, to the otic ganglion in this case, make a synapse, and have the postganglionic fibers here. Now, what's different between this ganglion and all of the other three ganglia are that this one would not give direct innervation to the structure it's innervating, but it would send fibers towards the auriculotemporal nerve, and these fibers would go along with the nerve and reach the target, right? While the other ganglia would send direct targets towards their glands or whatever structures. Now, what does this mean? This means that this nerve already has the somatosensory fibers, so the ganglion does not really need to send somatosensory fibers to the nerve, and in this case, it doesn't need really to receive such fibers. So, unlike the previous one, which gets some somatosensory fibers in order to include them in its fibers, in its nerves, this one will not have a somatosensory root, and this is the only ganglion on the head that does not have such, mainly because we explained the logic here is different, right? They would be in this nerve already. So the auriculotemporal nerve would carry the sympathetic and parasympathetic fibers from the otic ganglion for it, and it won't form solid nerves on its own that would reach the target. Now, lastly, let's go over the macroscopic anatomy. Where can we find them and what can we expect to see? If I have to be completely honest, during your dissection work, you expect to see almost nothing, because these are very small, very hard to dissect, and they are very variable. When you say ganglion, you expect like a small clump of cells and cluster of cells, neural cells, like a small ball, and from this ball you would expect a lot of fibers to originate or enter the ball, right? That's one of the cases, although those ganglia have very much a variable way of presenting themselves, and sometimes they're not like a solid clump, but like a cluster of small nodules, or they're subdivided into several small ganglia. And when you break up one very small nervous ganglion into several even smaller such ganglia, it's very hard to visualize. But where do you expect to find those neural bodies? For number 13, in this case is the otic ganglion, you can see that I've drawn the mandibular nerve that's transected, kind of cut off, and you have the major branch of the mandibular nerve here, right? The buccal, the lingual, the inferior alveolar, and the auriculotemporal. And so this otic ganglion would be behind the trunk of the mandibular nerve, which means medial, right? If you open the infratemporal fossa from this side, it would look like it's behind, but if you take a look at the head from the normal anatomical position, the correct term is it lies medial to the nerve and lies anterior to the middle meningeal artery. And you see how it gets one branch from the skull. This is the so-called lesser petrosal nerve. It gets one branch from the meningeal artery. The sympathetic truncating gives a branch to the auriculotemporal nerve that goes towards the temporal area, and from the auriculotemporal nerve, these branches would divert and go towards the parotid gland. So it would innervate the parotid gland and regulate its secretion. The submandibular ganglion. Again, a very small ganglion, similar case, located underneath the lingual nerve, number 4 here, over the submandibular artery and medial to the hypoglossal muscle. Now, what is the case here? You would see this ganglion getting a small branch from the from the lingual nerve, and this branch, if you remember, is basically fibers coming from the so-called chorda tympani nerve. You can see how chorda tympani joins to the lingual nerve, and later on these branches would divert from here. So this would be your parasympathetic input. Your sympathetic input comes from the facial artery, number 3 here, right? And the ganglion itself would give off branches. From here, of course, some sensory fibers would come from the lingual nerve itself. And you can see how the ganglion would give fibers to the sublingual and submandibular glands, regulating again salivation there. Basically secretion. Clinical perspectives. What is the clinical point of those two ganglia and why are we learning about them? To be honest, they're very, very niche things. And you would probably never have to think about them in your day-to-day life as a clinician. Just what is the major issues with those? Number 13, the otic ganglion. Very often there is, not very often, it's a very rare syndrome, but the major thing that we're discussing here is a syndrome called the Fraisse syndrome, and this one happens when you have some trauma to the parotid gland, most often during surgery. Or it could be any kind of trauma, really, just surgery is the most often reported one. So what happens there, these fibers, which innervate the parotid gland, get damaged, they get cut off or something like that, or torn out, and very often they rewire improperly and they kind of latch themselves to the skin. And at this point, you have a parasympathetic ganglion, a parasympathetic nerve innervating glands of the skin. And of course, what would happen here when the ganglion is activated, you would get activation of the glands. But in this case, you won't salivate, you will start sweating in the area of the innervation of the auriculotemporal nerve. Why? Because this would just activate the sweat glands, non-specifically, which are just nearby, right? So this improper wiring of these fibers is called the Fraisse syndrome, and something similar can happen to the submandibular ganglion. It's not called the same thing there, but the common word for these things is the so-called gustatory sweating. Why gustatory sweating? Gustatory means taste, sweating, you know what sweating means, of course. The point is when you taste something, when basically every time you would salivate, instead of only salivating, you would either get this very sweaty appearance of your skin, either in the zone of innervation of the auriculotemporal nerve or the zone of innervation of the lingual nerve here. Okay, so that's the video. Hope it was useful. Hope you enjoyed it. If you learned something, of course, leave a comment down below. If you didn't learn something, you didn't like it, tell me why. Again, interact somehow with the video. Very happy to have done it, to be honest. And until next time, have a great day.